This is a phase 2 randomized non-comparative study that aims at determining whether or not atezolizumab will be a candidate for a second-line treatment in small cell lung cancer with a recurrent disease after first-line conventional chemotherapy, namely carboplatin etoposide. So, in fact, we have a randomized study, 2-to-1, between atezolizumab and chemotherapy, but we let the chemotherapy free. So this is the investigator's choice to decide whether they prefer give a reinduction carboplatin etoposide or topotecan. And the primary endpoint was the overall survival at the 6th week in the eligible patients in the atezolizumab group, of course. And we also have a secondary endpoint, namely safety, survival, and also quality of life and markers. And I go directly to the result because I think it's what is important to say here in this few times of this interview. And in fact, we have only one patient out of 49 in the atezolizumab group who presented with a response at 6 weeks that gave a 2.3% overall response rate. And when we add patients with disease control, we have a disease control rate a little higher, about 9.5%. So we also analyze, of course, the safety, and we have no safety signal very unknown. We have some adverse immune events such as musculoskeletal and connective tissue disorders, gastrointestinal disorders, but anyway, there is no grade 3 significant safety signal. Survival, we have the progression-free survival differed significantly between the two groups in favor of the chemotherapy. That to say that in the atezolizumab group we have a 1.4 months PFS, and the hazard ratio for the atezolizumab arm was 2.26, so it's favorable for chemotherapy. But when we look at the overall survival in the atezolizumab group was 11.4 months, and in the chemotherapy group it was 9.5 months. The difference is not significant. The quality of life improved in both groups in parallel. We have nothing to say about that. And finally, about the markers, we test 3 different things. First, we test the PD-L1 expression of the tumor cells, but there is only one patient with an expression of PD-L1 on tumor cells. That to say that this is only a 2% frequency, so it's not possible to make any subgroup analysis. But when we look at the immune infiltrating cells, we have a little bit more with 16 tumors that were positive, but that doesn't identify a specific subgroup that could benefit the most from atezolizumab. Finally, we are undergoing a next generation sequencing of DNA extraction on free DNA, circulating free DNA, and our tissue DNA. For the moment, what I can say is that most of the patients presented with mutations, that's P53 and RB1's alterations are almost ubiquitous, and we try to find genes that could identify a subpopulation that could be benefit from the atezolizumab.